So welcome the colleagues from the media and to the National AIDS Council for a press briefing by our host for the Icasa 2020.
I just want to give you an update on what preparations have taken place so far towards the hosting of Icasa. We are now less than a month away from Africa's premier HIV and AIDS International Conference, and we are very proud that Zimbabwe will be hosting this very important conference starting on the 4th of December and ending on the 9th of December. We have continued to work hard as a country to ensure that all delegates attending the International Conference on AIDS and STIs in Africa enjoy their visit to Zimbabwe and experience a unique package of business and tourism. All our systems from security, banking, accommodation, transportation, health and others have been checked and tested, and I want to assure our visitors that Zimbabwe is ready. The security of delegates is guaranteed both in Harare and elsewhere as they go out about attending the conference and enjoying our rich heritage across the world, acclaimed tourist destinations. We have managed to adequately deal with the isolated outbreaks of cholera that were reported some months ago. Let me emphasize that our surveillance system is exceptionally effective and has picked all cases which have all since been treated. We are very excited as a government about the two high-level meetings which we are going to host on the 2nd of December in Victoria Falls as part of the build-up towards the Icasa. We will have a meeting of the African First Ladies to be hosted by our First Lady, Her Excellency Dr. Auxilia Mnangagwa. This meeting will focus on addressing prevention of mother-to-child transmission and the elimination of newborn infections in Africa. On the same day, we will also host the African Ministers of Finance, who will attend a meeting focusing on addressing domestic financing of the HIV response to reach the UN 2025 goals and the African Union Agenda 2063. As you are aware, Zimbabwe has already been praised globally for the homegrown domestic funding initiative in the form of the National AIDS Trust Fund, popularly known as the AIDS Levy. We are therefore very proud to be hosting this meeting to share our best practice while learning from the rest of the continent on other initiatives that altogether can increase Africa's domestic financing of HIV and other epidemics without totally relying on external funds. Logistically, we have engaged providers of public transport and agreed standard fares for ground transport in Harare during the conference. Designated passenger vehicles are being registered and will be marked to ensure that delegates have confidence when they use these vehicles. Pick-up and drop-off points shall also be marked for the convenience of our delegates. Zimbabwe has a steady in- and outflow of airlines, which we are confident are adequate to cater for our visitors. Ladies and gentlemen, it is very important for our visitors who require visas before traveling to apply for their visas on time. Those who need visas on arrival are also encouraged to ensure that they obtain letters from the government of Zimbabwe, assuring them that they will be granted visas on arrival. Our providers of accommodation services are all ready and capable to meet the varied requirements of their visitors. Delegates are advised to finalize their accommodation arrangements before leaving their countries to avoid challenges. I thank you.
As we have heard the Honorable Minister, the country is well prepared. And I can add that in 2015, we hosted Icasa here. It was very successfully. And that time, you were not having a new airport. It showed the preparedness. Now you have a new airport in Harare. You have also a new airport in Victoria Falls. This one strengthened the logistic to host a kind of conference like Icasa in Harare. We are expecting, normally we shoot for 8,000 delegates because the documentation for Icasa is ready. You can see here, you have the Icasa program book is ready. And we are really expecting that we host here a minimum of 245 sessions during the conference. And we are expecting 735 speakers for the program. This is what I can say as regard to the expectation and how readiness the country is to host Icasa and the delegate. In terms of research, if you want to hear about the research, you need to glance through the conference program, especially the abstract books. And let me give you the first information. At the open ceremony, we have one of the best researchers in the world talking about how they discover the malaria vaccine. Please, you are all invited.
The area you were talking about is the new area for HIV prevention, and this is under biomedical prevention. Which products have come out to prevent HIV? The dapivirine ring you're speaking about is a product which is a ring. It's a silicone ring with a drug called dapivirine, which is impregnated in the ring, and when it's put in the female genital tract, it then attacks the upcoming virus. We assume that we're talking about a woman who's HIV uninfected, and if she has a partner who's infected, that dapivirine in the ring will attack the virus so that she doesn't get infected. Fast forward, there were results which showed that women who use it consistently, by the way, it's used, you put it once every 28 days, and you sort of have to do that every 28 days. Women who used it consistently showed a protection close to 55-60% of preventing HIV. Now, Zimbabwe was in fact the first country, the medical MCAZ, our health authority which registers medicine, was the first country in the world to register that. So we are very pleased that we had that recognition. And fast forward, what you're talking about in South Africa is not a rollout at national level. These are really demonstration programs. And the Ministry of Health has a plan for demonstration programs before it can be rolled out. So those plans are on way. We are on track. Thanks for asking.